12 signs of unresolved childhood trauma in adults. 1. Difficulty forming issues. Adults who do not form a healthy and positive attachment to their parents and caregivers have trouble establishing healthy relationships as children. These individuals also have difficulty developing and maintaining romantic relationships as adults, so they tend to have more marriages. Your brain is here to protect you, so one of the implications of childhood trauma is that the world is not really a safe place. This is why individual with a high ACE score has difficulty trusting others and fear of abandonment. Though anxiety and depression. Multiple other studies have confirmed that childhood trauma is linked with greater rates of anxiety and depression. Someone with an ACE score of 4 is 4.5 times more likely to become depressed than someone with an ACE score of 0. Teen inability to cope with ROUTINED stressful life events. Adults who do not develop healthy coping habits as children struggle to cope with day-to-day life stressor. 4. Low. Adults with adverse childhood experiences can develop PTSD. And adults who develop PTSD from childhood trauma may struggle with fear, anger, self-destructive behavior, and low self-esteem. 5. Poor academic disability. Childhood trauma affects one's ability to learn. When all of your resources are going to the limbic system, the survival part of the brain, there is less blood flow for education and learning because, ultimately, survival trumps everything. 6. Substance behaviors of any sort. Childhood trauma affects areas in the brain like the nucleus accumbens, the brain's pleasure and reward center that is connected to substance dependence. These high ACE scores also tend to have more drug prescriptions which can lead to addiction. Additionally, individuals who have 4 or more adverse childhood experiences are twice as likely to be smokers, are 7 times more likely to be alcoholic, and 10 times more likely to have injected street drugs than someone with 0 ACEs. When someone is so used to living in a chronic state of fear, it is easier to regulate that state through drugs and alcohol use, cutting, and self-harm. 7. Hyperactive or constantly on edge. The hypothalamic pituitary adrenal axis, the brain's and body's stress response system oversee our fight or flight response. When we are in danger, working together, these systems trigger stress hormones such as cortisol and adrenaline to provide us with the energy resources necessary to thrive in dangerous situations. However, because art constantly ill or sick, adverse childhood experiences affect the developing immune system, which works together to protect you from bacteria, viruses, parasites, and fungi that cause infection, illness, and disease. People with a 4+ ACE score are 240% at greater risk of hepatitis, 390% more likely to have a chronic obstructive pulmonary disease, 240% higher risk for a sexually transmitted disease, and have more autoimmune diseases. Nor have attempted suicide. Furthermore, other studies, not just the ACE, also affirmed that suicide attempts were significantly greater in adults who experienced childhood trauma such as physical abuse, sexual abuse, and parental domestic violence. Compared with people with a 0 ACE score, an individual with an ACE score of 4 or more is 12 times more likely to have attempted suicide. 10. Have a bad memory, poor concentration. When you're under constant or chronic stress, the stress hormone cortisol remains high. When that happens, it affects your body's most essential functions, which include your memory and concentration. 11. Struggle with obesity. Weight gain can be an indication of the body being highly stressed. 12. Engage in behavior. Adverse childhood experiences hinder the prefrontal cortex, which is necessary for impulse control.